Hey guys, welcome back to another video. For those of you that are new here, my name is Rami and today's video is going to be all about nursing school hacks. These hacks can actually be used if you are currently a nurse and you just want to learn some fun facts that have helped me. I'm going to be talking about IVs, catheters, just a bunch of things that will help you in your nursing life no matter what kind of nurse you are. So I came up with 10 nursing hacks that have truly helped me in nursing school and as a new nurse. So I hope these help you. So let's go ahead and get right into the video. So my first hack has to do with IVs, how to start an IV a lot easier. I'm just gonna go ahead and put a warning right here. If you do not like needles or if you don't like looking at needles, feel free to skip ahead a couple of minutes. I'll put times down in the description box to show you what time each nursing hack will be. So go ahead and skip ahead if you do not like looking at needles. But if you are in nursing school, you will eventually have to start an IV or do a phlebotomy lab stick. This may help you get into the habit of looking at needles. So I have an IV catheter right here, and this is a 22 gauge, which is actually a really small IV. Normally in women's and labor and delivery, we start 18 gauges. So if you guys didn't know, the lower the gauge number, the bigger the needle will be. So as you go up, so a 22 gauge would be smaller than an 18 gauge if you guys didn't know. Usually I find that a lot of nursing students that I work with can easily get the vein and get the flashback, but they have a lot of difficulty threading the actual needle in, whether they can't actually thread it, or their needle just gets stuck and they blow the vein. I did this a lot when I was first starting IVs as a new grad nurse in my first few months of orientation, and no one told me this until I did my triage rotation like a few months in. That truly helped me pretty much thread my needle so much easier. So I'm pretty much just going to take out my IV catheter. And obviously I'm going to have gloves on whenever I am doing this, but I'm at home and for the sake of teaching, I'm not going to have any gloves on. But normally I would have gloves on in the hospital setting, you guys. Before I start my IV, I pretty much get all my supplies together. You guys will have an IV start kit, but this hack is specifically for helping you thread easier. So the thing I learned to help me thread the IVs easier is take off the cap and loosen the hub. So the hub is this colored part right here. Each color is specific for each gauge. So 22s are usually blue, 20 gauges are pink, and 18 gauges are usually green. My hack is to loosen the hub before you thread it. So before you loosen it, it will be stiff. It will just pretty much go up and down like this. But if you loosen it, you can pretty much thread it in at any angle and it won't be stiff to one specific thread, if that makes sense. But if you loosen up the catheter, like wiggle it back and forth and move it up and down like that, you've loosened the catheter, so pretty much it will thread a lot easier. I feel like I pretty much went from getting no threads, like 0% of my threads, and blowing all my IVs pretty much in the first couple months to pretty much getting all of them, because it's really easy for my students and for me myself in the first few months of new grad to get the vein and get the flashback. Right here is where you'll get the flashback in this little plastic space. But just threading was just so difficult. And I'm gonna give you guys another hack related to this. Sometimes when you guys are threading after you've loosened the valve, you still won't be able to continue to thread, if that makes sense. Sometimes you can thread really easily, but sometimes when you hit a valve in the vein, which just prevents the backflow of blood, sometimes you hit that and you cannot thread any further than that. So pretty much you have to take out the needle, take it out completely. So let me just kind of demonstrate. Once you've threaded as far as you can and it won't thread further, you will leave where you are at and a little bit of catheter will be kind of out. You'll leave the position where you're at and just take out the needle. You'll hear that click and then just take out the needle from the hub. And obviously you guys will, this is not a very good demonstration. You'll hold that while you take out the needle, you just twist it off, and then you will put in your piggyback or the IV tubing, you will connect it to this little hub. So pretty much when you have the little bit of catheter sticking out of the vein, like pretend it's like halfway, let me see if I can show you guys better. Pretty much to get that catheter in, you will connect your piggyback. The piggyback is just a small piece of tubing. It's like a small extension that will have the flush connected to it, and you flush while you're pushing the catheter in. So that way the valve opens up and you can thread the rest of the catheter in. So that's my hack. If you guys can't thread further, don't freak out, don't get scared. Take out the needle in whatever position you're in and then flush and thread the rest through at the same time. So those are a few hacks in starting IVs and making your IV starting a lot easier. So my next hack has to do with flushing. Really easy one that I didn't learn until like my last year of nursing school. So pretty much I have a flush. I'm just gonna open it up. You may have heard of this hack before, but I'm just gonna go over it really quick. Pretty much when you have your flush, you have a little bit of air in your flush. You don't want any air in your vein. So what I used to do was just take off my cap and push up, let the flush fly out everywhere. It even hit a patient one time. I accidentally opened the flush kind of facing the patient because usually it'll be a few drips coming out, but this one flew. Like the flush just flew out at the patient and I was like, oh my gosh, I'm so sorry. What I finally learned, a nurse finally told me, was to pull the flush back to get rid of that vacuum seal that will just make all the flush come out really quick. And you push back and then you push forward, if that makes sense. So that way you just get a few drips coming out and it never splashes out at the patient, you guys. So what I meant before that, it won't do it now because the seal's broken. When I used to push up, I used to go like this and just fly everywhere all over the place. Sometimes it would be short, sometimes it would fly up to the ceiling. To get rid of that air in that flush, just pull back and pull forward. And it will never make a mess, you guys. I promise, trust me. So my third hack is gonna be all about catheters and catheter starting. I know this is a skill that a lot of nursing students are nervous about, but I have a few hacks that will help you find that urethra every single time. So this is for women, obviously, because it's a lot harder, but for men, you know, it's pretty easy to not miss it. So these hacks are specifically for starting women catheters. So the setting up part is fairly easy if you guys have practiced it a few times, you know, maintaining sterility and just kind of setting up all the equipment in the catheter box, I guess, or catheter start kit. Pretty much I have a few hacks to help you find that urethra because I feel like even as a nursing student and a new grad, I was like, what am I looking at? What am I looking for? When you guys are in there, make sure to get in there. Like, don't be afraid to just use your fingers. Make sure to open up as much as possible so you have a good visual of what you are looking at. I find that a lot of nursing students open up the exterior labia only, if that makes sense, but try to get the interior as well so you can kind of see everything that's going on. So while you're cleaning with your betadine wipes, which is the little orange soap that you'll use to clean the urethra, look for bubbling. So when you're looking for bubbling, that pretty much means that that's the opening. So you're looking for a slit that bubbles or kind of a small open hole that bubbles. That means it's getting air inside, so that means that is the hole. So that pretty much helps me every single time while I'm cleaning. Just look for the bubbling. If you still don't see the bubbling, you can ask them to cough. Sometimes people say that you have to look for the wink. This is also kind of what happens. Sometimes when you're cleaning it, it will open and close like a little wink. So that's what people mean when they say look for the wink. But you can also look for the bubbling instead. If you still don't see that wink or bubbling, you can ask the patient to cough, and this will cause the winking effect as well. It will cause the urethra to kind of open and close. So you can ask them to cough and that kind of helps them bear down a little bit, which will open up the urethra. So that is my second tip to help you visualize the urethra. And my third tip is if you happen to go a little bit lower, you can leave the catheter in there and ask for a new catheter. And the first catheter you put in will kind of act as a placeholder so you don't get into that spot again. So kind of leave that first catheter in there and use a second catheter to go a little bit higher. Aim higher every time you go a little bit lower. Those are all my catheter tips. If you guys have any questions, of course, leave me a comment. So my fourth tip, this helps every single time. It's to help with nausea. If people are nauseous or they're actively vomiting, you have to go run back and get some Zofran or some kind of antiemetic to help stop their vomiting and nausea. But of course, that takes a while. It takes a few minutes. As a nursing student and nurse, I always recommend keeping alcohol swabs in your pocket. You can immediately open up that swab and hold it to their nose and ask them to sniff it. And this pretty much subsides their nausea almost every single time. For some reason, smelling that alcohol subsides nausea and helps their nausea pretty much go away. Them inhaling it while you go get their antiemetic, their nausea medication to help them out. I don't want them suffering in the meantime in those few minutes. So make sure you keep swabs with you wherever you go as a nursing student or nurse. Fifth tip is to keep peppermint oil or any kind of oil in your bag that you can use under your mask, especially now that COVID is here. Everyone's wearing masks at the hospital, so you will wear one too as a nursing student and of course as a nurse. So keep peppermint oil with you when you have those code browns, or if you have to clean up any kind of bodily fluid that will smell, if you're doing a wound dressing, things like that. Use that oil and wipe it on the inside of your mask so you pretty much don't smell it at all. You can use peppermint oil or even Vicks. I've heard from a few other nurses. My sixth tip has to do with taking vitals, and it is for counting those respirations. Of course, you've heard that a lot of people just put 16 or 18, but you know, your nurse will know if you're a nursing student, if you just put 16 every single time, that you're actually not counting the respirations. So this is what I used to do as a nursing student, is after I take their vitals, I ask to count their pulse on their wrist. To make sure that it matches what I'm reading. I always say, hey, I'm just gonna take a pulse on your wrist to make sure what I'm seeing on the machine is correct, and they kind of just give me their arm, but I'm really looking at the rise and fall of their chest while I'm taking their pulse. So that's how you count respirations without the patient knowing that you are counting the respirations, because every single time you tell them they're counting, it'll definitely be inaccurate because they will know and then they'll breathe even slower. Wait, do you want to say hi? Hello. You wanted to be in the video, clearly. Say hi, Bear. My seventh tip has to do with pediatrics mostly, but it'll work with your adult patients as well, is to warm your stethoscope before you listen to their lungs or listen to their heart. But I mostly do it before listening to babies, because if you're assessing the baby in the room with the parent, they will start screaming if you put that cold stethoscope on them. So I always recommend warming my stethoscope. Usually I'll warm it on their blanket before I listen to their chest, because it's really hard to listen to a baby's heartbeat or listen to their lungs, listen to their respirations over their shirt. Sometimes I'll do it over their shirt if I can hear it, but usually you'll have to put it under their shirt, right on their body, and they will start screaming if you do not warm up that stethoscope beforehand. You can hear it more clear in an adult patient. You can kind of listen to the over their gown, but I recommend this mostly for pediatrics, as the parent will be more reassured if their baby is not crying in the room, because it always stresses them out, especially if it's their first kid. So warm up that stethoscope before you listen to that baby. My next tip, my eighth tip, is if you're in med-surg or geriatrics clinicals, you will usually come across patients with dementia or patients with Alzheimer's. Sometimes they have panic attacks, sometimes they can't go to sleep, sometimes they're just riled up. My hack for this is to get 2 warm blankets. All hospitals pretty much have warm blankets. Ask them where their warm blanket machine is and get 2 blankets and put it on that patient who is panicking or wondering where their son or daughter is, or their pet even. Sometimes they have delusions. I recommend putting those blankets on them because for some reason the warmth of that blanket comforts them and it helps calm them down. I highly recommend doing that if you have a dementia or Alzheimer's patient. My second to last tip has to do with NG tubes. You guys will probably do an NG tube while in nursing school and be really scared about it, because patients do not like NG tubes because you have to put that tube down their nose, past their throat, and into their stomach. Usually whenever you're telling the patient while you're putting the NG tube down, you usually tell them to swallow. So they're swallowing while you're sticking that tube further and further down. So they're pretty much swallowing the tube. My tip for this is, if they are allowed to, if they're not NPO, have them chew ice chips or crunch on ice chips while they are swallowing, because the coldness of the ice doesn't activate their gag reflex as much. And when they're not gagging, it's a lot more comfortable to put that tube down. So if they're allowed, have them crunch ice chips, let them swallow those ice chips down in the cold while you're putting down the NG tube down. Will kind of just help make things easier, maybe even numb their throat a little bit more, so they feel like they're just swallowing ice chips or swallowing something cold and not a big old tube going down their throat. So try that next time you guys put an NG tube down. Final and last tip is pretty much cleaning up dried blood. You guys will always have to do it, whether the blood from their IV dries or they're bleeding. Pretty much you will come across dried blood all the time. And my tip for rubbing it off without rubbing their skin too hard, because sometimes we deal with older patients patients and their skin is really sensitive, you don't just want to scrub off that dried blood, my tip is to use Surgilube or KY jelly. Put that KY jelly or Surgilube on that dried blood, let it sit for a few minutes, and it will come right off. Make sure you guys try that next time you have some dried blood that needs to be cleaned up somewhere. I hope all these tips help you guys while you guys start nursing school. I know everyone's starting their semester while you start clinicals, or if you're just a current nurse, you just wanted to look up some nursing hacks that will help you on your unit no matter where you work. Leave me a comment if you guys try any of these and if they've helped. Don't forget to hit that red subscribe button to join the family, and make sure you like this video, and I'll see you guys in the next video. Bye!